Messages need to be clear, they need to be consistent with the facts as we know them, and they need to be coordinated among all messengers. I think when we don't do that, it creates confusion that contributes to polarization, politicization, and even vaccine hesitancy. And as we've seen, it's divided our country. I think with any pandemic, we have a window of opportunity. And if you can see these signals, and there were signals, you need to mount your defense quickly.
With adequate resourcing and planning, I don't know that it would have gone perfectly, but it could have gone better for sure.
We had a plan, and we were caught flat-footed in a number of ways. I kind of look at Congress like a golden retriever in a room full of tennis balls, kind of waiting for one of them to start bouncing. Funding had really suffered. CDC on the national level or public health agencies at the state level. The strategic national stockpile had gone through several rounds of cuts, 2010 through 2018. I think it was just, poor preparedness all the way through, lack of funding, lack of focus. But I think we have a real opportunity here, while that ball is bouncing, to try to assess what went wrong, what we need to do.
I think on the positive side, though, was our ability to be a lot more nimble than we'd ever seen ourselves. We had Hunter Douglas, the blind company, switched over all of their production to N95s.
We were functioning as a unit in a way that there really hadn't been any impetus to before in terms of data sharing, in terms of coordinating who's getting what care where.
And, one of the things I think we have learned is just the speed at which the vaccines were created. Really applying those lessons to all the other promising therapeutics coming down the pipeline. How can we safely move this trial at a faster pace?
I mean, the FDA is absolutely awash in real-world evidence because, you look at the vaccines, you look at the therapeutics, you look at the diagnostics, a lot of this is going to have to do with post-market monitoring. How do you use data that's collected in EHRs and other sources in a way that's clinically meaningful? So,
we have a treasure trove of data, and I think we're at a point now where we can really begin to disaggregate the data by social determinants, which can help lead us more towards precision innovation.
If there was one thing I would say would be helpful, would be the nimbleness of manufacturing to come in and help with the supplies earlier.
People that we're putting in the most responsible positions for determining public policy in the event of a crisis is to make sure those individuals are well grounded in what actually happens in healthcare and not so worried about the political consequences